Hello, everyone. It's my pleasure and my honor to join this session and this event. And I would like to thank Dr. Dieter Manstein for inviting me to be speaking at this session. My talk today is going to present a study we published in 2019 about the efficacy and safety of long pulse 1064 and 2940 nanometer lasers in non-invasive lipolysis and skin tightening. I understand that the focus today is for the skin lipolysis using the laser and the heat, but I'm presenting the study as it was, and we'll focus about the lipolysis. My name is Ashraf Badawi. I'm the Vice President of the European Society of Lasers and Energy-Based Devices and the President of the European Society of Cosmetic and Aesthetic Dermatology. So we agree that the non-invasive body shaping is becoming growing demand, and non-surgical procedures are preferred due to the fewer side effects and shorter recovery time. In relation to the fat reduction, skin tightening is very important because many people went through the process of lipolysis, whether invasive or non-invasive, and then at the end they were left with lax skin, which was cosmetically not what they expected. So that's why the technologies which are combining the lipolysis and some sort of tightening are preferred. Now, in our study, we used two lasers. We used the 1064, the Nd:YAG 1064, which is very unique wavelength because it's absorbed by water, by hemoglobin, and by melanin, and that's why it is used for multiple applications. But in this particular application, because the absorption is low by the different chromophores, the penetration depth is very significant, and that's why we are able to achieve deeper depth of penetration and efficacy on the fat. The erbium YAG is known to be absorbed by water. However, in this study, we used a long modified pulse in order to have non-ablative effect on the erbium to help in the tissue tightening, in the skin tightening. So the fact is that the heat is affecting the adipocytes. And this was a study conducted on the radiofrequency in vitro, where they were able to report the hyperthermic injury which happens and occurs to the adipocytes by exposing the adipocytes to high temperature. So they found out in this study that 60% of adipocytes do not survive when exposed to only 3 minutes of 45 degrees Celsius. And this was another presentation by Dr. Duncan Diane in 2016, the ASLMS, where she presented her findings with the electron microscope on the fat cells with increasing temperatures with the radiofrequency, so with 40, 42, and 43. And it was found that more cell deformation is happening at the temperature of 43 degrees Celsius. So when we are using the long pulse erbium YAG, this is a non-ablative laser skin remodeling, which is preserving the epidermis and lead to immediate collagen shrinkage and neocollagenesis. So this will improve the skin laxity, which is not our domain today. So we wanted to evaluate the effect of the combination of erbium YAG and Nd:YAG with objective measures because this was missing according to this publication. So this didn't occur before. So we wanted to objectively examine the safety and efficacy of this combination of 1064 and 2940 for lipolysis and skin tightening. So we included in this study 10 female patients. The mean body mass index was 26.8, the range between 19.4 to 38.1. Inclusion criteria: visible and measurable excess fat on waist and abdomen. And we excluded patients who are pregnant or on anticoagulant or history of malignancy and acute dermatitis on the treated skin surface. The measurement of the clinical efficacy was visual evaluation with photo documentation, waist circumference measurement, total body fat measurement, subcutaneous fat tissue thickness measurement by two ways, the 2D B-mode ultrasonography on 6 points, and low-dose native CT. Also, we did subcutaneous fat and skin stiffness measurement by shear wave elastography. This is a recently developed non-invasive method for measuring the tissue elasticity. This imaging method is operator independent, reproducible, and quantitative. It has been used successfully in evaluation of hepatic and breast lesions, and this is the device which we used. The study protocol was in the week 0. We did photos, circumference measurement, body fat mass, ultrasound, CT, and elastography, and then we did the first laser treatment. Then 2 weeks later, we did the photo, circumference measurement, and body fat mass, and then we did the second laser treatment. Then 2 weeks interval, we had the third and the fourth laser treatment with the same measurements, and then week 8, we did again the same measurements we had in the first visit to evaluate and to do the follow-up. We used the Nd:YAG laser for lipolysis and the erbium-YAG for improving the skin. The protocols we used was we used a scanner, the L runner with the 1064. We used piano mode, which is a very long pulse duration, 1 to 6 seconds. So it's like a continuous wave. The scanning surface was 78 by 84 millimeter. The power flux density was 1.2 watt per centimeter squared, and the fluence 108 joule per centimeter squared. And then we treated the skin areas in 9 different fields. Skin surface temperature was monitored, and we wanted to achieve 42 degrees and maintain that for 8 minutes without cooling in our protocol. And then the second step was for the erbium-YAG, which is not our domain now, to improve the surface of the skin. This video is showing the scanner where we are applying the Nd:YAG laser on the skin. We can see mild erythema. There is no significant pain. The patient is tolerating the pain. We don't use cooling. At least this is what we did in our protocol. There are some modifications where they started to use cooling to cool the surface and allow the heat to be trapped in a deeper layer, but our protocol was not having cooling. And this is the erbium-YAG, which was done after the Nd:YAG in order to address the surface of the skin and the elasticity and improve the quality of the skin. And this is how the skin is ending, a slight erythema, which is associated with the erbium-YAG, but it is non-ablative procedure. And this is one of the patients before the first treatment and after the fourth treatment, and we can see some significant fat reduction. So it is very clear. And again, the same patient lateral view, and also we can see the significant fat reduction after the fourth treatment, 2 weeks after the fourth treatment. This is another patient, moderate fat loss. And this is another patient where we can see also good improvement in the fat. The waist circumference measurement, there was a statistically significant difference between before and after values. Regarding the total body fat, also there was a statistically significant difference between before and after values. And this was the 3-dimensional CT image, which is showing that the yellow is the before, and then we are going to have the red color, which is showing the after, and the amount of reduction between the before and after, reduction in the fat before and after. And we can see the reduction in the fat, which was really significant. So this is the overlap of the 3-dimensional CT images, which is showing the significant improvement. And this is also showing the decrease in the fat tissue in the axial CT view, and we can see that the gray is the before and the blue is the after. So we can see the difference between the before and after in a significant manner for this particular patient. And this is the coronal CT view, and again the gray is before and the blue is after, and we can see the significant reduction in the fat in this patient in the coronal CT view. So regarding the skin firmness before and after with the shear wave sonography, there was all participants' skin firmness improved, which is not our issue. This is the photos of the shear wave elasticity or elastography, and it shows good improvement in the elasticity of the skin. No complications were reported. It has been reported that the use of 1060 nanometer diode laser leads to hyperthermic temperatures within the adipose tissue with subsequent lipolysis. And this was published in 2017. The 1064 laser generate thermal effect appropriate for lipolysis, and this was in 2009. Different laser systems were reported to be able to tighten skin while diminishing the quantity of fat, and combination of different wavelengths seemed to be useful in terms of skin tightening as well. And this was published in 2018 and 2015. So elastography was something new we added in order to objectively measure the skin elasticity. It estimates the tissue firmness, and I think this is an appropriate for the future treatments and investigations. The limitations of this study included the outcome of longer follow-up. We should have done a longer follow-up. Impact of lifestyle changes. If the patient is having diet or exercise, is it going to improve the outcome? The cost effectiveness when we are using lasers for this amount of time, how much are we charging the patient? Is this going to be cost effective or no? And the future perspectives, what should be the maintenance protocol? This is something should be studied. If we are going to do those 4 sessions, how frequently we need to maintain or do more sessions? Can we apply that on the face and neck and double chin? And the safety of efficacy with objective evaluation. And this is my presentation, and this was our study. Thank you very much for having me, and I'll be very happy to have any questions after the session. Thank you.